Welcome to the recording of the webinar, Vaccination in Adults, Challenge Across European Countries. The presenter is Dr. Gindrovel Dumitra and the webinar is hosted by Dr. Ferdinando Petrazzuoli. This webinar was recorded on the 30th of November 2022.
Good evening, ladies and gentlemen, dear colleagues. It's a pleasure for me to introduce to you the president of WONCA Europe, Professor Shlomo Winker, for tonight's webinar on adults vaccination. Please, Shlomo.
Good evening, everybody, dear colleagues. I'm very delighted to open the first lecture in a series of webinars that will deal with clinical topics. We'll start with vaccinations, but then we will continue in the coming months with various other clinical topics. I would like to ask you if you have any special topics that you think that we should discuss, then just email to me or to Ferdinando or to our WONCA Europe secretary, and we will consider those topics for our series. Also, if you know or you can recommend of good lecturers, we will be also happy to know the names and their qualifications and maybe to put them as future lecturers. So, as the president of WONCA Europe, I'm very happy and delighted to open this clinical series, and I will give the stage for Ferdinando, who is the moderator of this session, and I hope that we will have a very successful evening.
Thank you very much, Professor Winker. And now it is time to introduce the keynote speaker for tonight's webinar, Dr. Gindrovel Dumitra. Dr. Gindrovel Dumitra is Vice President of the National Society of Family Medicine in Romania and is the General Secretary of the European Union of Family Physicians, or UEMO for short. So the topic for tonight's is vaccination in adults. Please, Dr. Dumitra, the floor is yours.
Thank you very much, Ferdinando. Thank you very much, Professor Winker. I am glad to be here, and I want to thank you for being with us in this evening, especially from our colleague, general practitioner. It is very important to address a very important segment of our activity. It is about, it is about the vaccination in adult, because we have a few challenges across the European country. In that moment, the vaccination, it is one of the most important primary preventive intervention in our offices. And also in the recent years, we have met one of the biggest public health challenges, namely a pandemic. Fortunately, this new disease, COVID-19, has become a preventable disease through vaccination, vaccine preventable disease. The role of vaccination in limiting the effects of the pandemic is as obvious as possible. On this occasion, I saw as obvious as possible what is the role of the education for healthcare. In some countries where the population was aware of the benefits of the preventive intervention in adults, an optimal level of vaccination coverage was quickly reached. While in the country where the adult population was not exposed to prophylactic intervention programs or was exposed less, this optimal vaccine coverage were not reached. But adult vaccination means much more than COVID-19. Each year, vaccine preventable disease kills thousands of adults across the planet, causing a significant human toll and severe economic burden on the world's healthcare system. While immunization is recognized as one of the most effective primary intervention services that improve health and well-being, adult immunization rate remain low and large gap exists between the adult immunization goal and actual adult immunization rate. Currently, the vaccination coverage in the European adult population is wide the expectation of influenza vaccine suboptimal, as you can see below. Vaccine constitutes one of the main foundations of the public health system, improving the quality of and life of the expectancy of people. The role of primary care healthcare is essential in order to improve the vaccination coverage, given the patient closeness and trust, because it is very important. The family physician, it is the mainly communicator regarding the vaccination. And our recommendation of vaccination for reason of age, underlying pathology, work circumstance, or any other factor that may endanger health and be preventable by vaccination, and at the same time have clear criteria of what should not done in this countryside. Today, we will discuss about the vaccine use in adults in European country. We will discuss after that about the necessity of the national program for adults and a short discussion about the vaccination passport. From the first vaccine use in adults in European country, we have a landscape, because in that moment, some vaccine preventable disease, it is regulatory international and authorization body. There are a number of diseases that can be prevented by vaccination, such as diphtheria, varicella, influenza, hepatitis A, hepatitis B, HPV infection. It is about cervical cancer in the first place, measles, meningococcal disease, mumps, pneumococcal disease, in special septicemia, and also meningitis with pneumococcal, rubella, zoster, tetanus, pertussis, and also COVID-19. It is available in that moment some vaccine. For this, there are a number of vaccines like diphtherotetanic pertussis. It is 3 vaccine, MMR, measles, mumps, rubella, plus and minus varicella, flu, pneumococcal vaccine. It is about the vaccine conjugated pneumococcal and also polysaccharidic vaccine, hepatitis A, hepatitis B, HPV vaccine 9-valent, it is available right now, meningococcal disease with 2 vaccines, 1 vaccine from serogroup B, and also other 1 vaccine conjugate against serogroup A, C, W, and Y. It is available in just 1 country in Europe. It is about the zoster vaccine. It is disposable from Germany, for example, and not at the least the COVID-19, because we have in that moment a special discussion about this. We starting discussion about the 3 vaccine against diphtheria, tetanus, and pertussis. This vaccine is administered to children in the primary and booster vaccination schedule in the first year of life, and at least 2 boosters in the childhood. Afterwards, there should be a booster every 10 years in adults. At the moment, only 10 countries have booster program with this vaccine, and 6 only with diphtherotetanic, without the pertussis components. No policy it is no vaccination policy are in place for diphtheria in 12 countries, unfortunately. In 11 countries from tetanus, and in 24 countries across Europe, it is no policy about the vaccination adults against pertussis. Diphtheria was for a long time considered eliminated from Europe. Unfortunately, the persistence of some area where vaccination coverage is reduced show us the need to maintain optimal vaccination coverage. For example, in Spain, in 2015, adolescent was diagnosed with diphtheria and died after a trip to another country. It is Russia. The boy was the first case of diphtheria in Spain after 28 years. The boy had not been vaccinated against the disease, which his parents now attribute to being triggered by anti-vaccination groups. It is a very high cost, unfortunately. And the bad news doesn't stop there. Already 8 other Spanish children have been found to be carrying the Bacillus diphtheria bacteria that cause this illness. Fortunately, all these children have been vaccinated and consequently have not developed the disease, but the danger of other unvaccinated children becoming exposed remain high. They can transmit this illness, unfortunately. In Ukraine, due to decrease in vaccination coverage among children, the largest outbreak of diphtheria occurred in Zakarpattia region, 5 cases. In Luhansk, Ternopil region, 1 case in each region. In the Kiev city, 2 cases of the dangerous disease have been registered a few years ago. Another 10 cases when people happened to be carrier of the disease were reported in another region. Tetanus is not a disease that can be considered eliminated, and the occurrence of an incident that ends with the appearance of the tetanus risk wound is a frequently encountered event. It should be mentioned that in case of the appearance of such wound in adults, only 1 dose of tetanus toxoid can be administered only if there is a primary vaccination schedule. Whooping cough is still present among us, pertussis. In adults, it can cause an acute respiratory disease that is followed by coughing for a longer period of time. It is also known as 100 days cough. The appearance of the non-corpuscular vaccine based on acellular pertussis represent an opportunity to be administered to adults, and especially to pregnant women who can create a cocoon around the little newborns. In this way, the vaccination of adults bring a huge benefit in terms of herd immunity, protecting newborns until they are able to receive the first doses of the vaccine. Poliomyelitis. After the eradication of the smallpox, poliomyelitis could be the second disease declared eliminated due to vaccination effort. At the moment, there are 1 outbreak in Afghanistan, Pakistan, and also in Nigeria. Poliomyelitis caused by poliovirus type 2 has already been declared eradicated. Polioviruses type 1 and 3 are still circulating. In recent years, there have been cases of the vaccine-derived polio in Ukraine, and its circulation demonstrated the absence of herd immunity. In September, the polio virus was identified in London sewage, a fact that led the British authority to start a vaccination campaign among children because they are at a high risk of developing severe forms. And in the case of poliomyelitis, herd immunity is very important, considering the fact that severe forms develop in children either in the form of paralysis of the respiratory muscle, in the form of paralysis of the peripheral motor nerve. In that moment, in 32 countries, there are not vaccination policy against poliomyelitis specifically for the adults. Measles, mumps, and rubella. We have the program only in 11 European countries. Between 2016 and 2020, Romania went through a measles outbreak in which 61 people died, including in adults, unfortunately. The MMR vaccine protects against measles, rubella, and mumps, and it is very important for each GP to evaluate the preconception vaccination status. The risk generated by falling ill with rubella during pregnancy are measured, as you can see. After the administration of the vaccine, there must be a break of 1 month till the woman become pregnant. It is one very important attention from the general practitioner when discussed with a woman to want to become pregnant. Pneumococcal vaccination. The pneumococcal conjugate vaccine was difficult to introduce into the childhood vaccination schedule in some countries. For example, in Romania, we started the vaccination only in 2017. It protects against several invasive forms of pneumococcal infections such as septicemia and pneumococcal meningitis. In the immunosuppressant adult, as well as those who have certain chronic disease, surgical intervention on the air, a vaccination scheme is indicated that use the minimum 13-valent pneumococcal conjugate vaccine, followed by 23-valent polysaccharide vaccine. It is very important to obtain long-term memory through the pneumococcal conjugate vaccine. As you can see in this schedule, unfortunately, in 7 European countries, this vaccine is only available for a fee, not free of charge. Unfortunately, I can see, because it is huge discussion about this, especially in special groups. About the HPV infection, there are some quite good results found in Canada, Australia, and some European countries, a fact that lead to the emergence of the global consensus for the elimination of cervical cancer in this century. Europe has more ambitious target, this fact being possible in some European countries till the end of this decade. The HPV vaccine is administered to adolescents starting at the age of 9, and in all European countries there are now national programs. Only 9 European states have catch-up programs over the age of 18 for unvaccinated women. In the last day, I have a meeting with the parents in one high school in Craiova, and the woman claimed she wants to be vaccinated free of charge, because unfortunately the HPV vaccine, it is very, very expensive. For influenza, before the pandemic, the flu vaccine was the only vaccine that was available free of charge for some people belonging to the risk group in all European countries. The risk group established by the WHO are children aged between 6 months and 5 years, pregnant women, people with chronic disease, the elderly over 65, and medical personnel. In some European countries, certain professional categories or institutions and personnel are also included. In the USA, it is annual universal vaccination is recommended. In Europe, we propose that the people from risk group reach 75 coverage. Unfortunately, as you can see in the right image, just few countries come close to the proposed target. Influenza vaccine have also evolved a lot. In general, now tetravalent vaccine are used, which contain 2 types of inactivated type viruses and 2 genetic lines of type B, Victoria and Yamagata, as you can see. Influenza virus, precisely due to the difficulty in predicting that circulating types, high-dose flu vaccine have recently appeared, which are especially aimed to immunosuppressant patients. The biggest challenge of recent year has been the COVID-19 pandemic. Unfortunately, we went through a very difficult period in which we were able to see what are the resources that can use during this period, and above all, we saw the limits of the sanitary systems. Fortunately for us, a vaccine has also produced rapidly, quickly. Almost simultaneously, several vaccines were produced using new innovative technologies such as RNA messenger or viral vector-based. Some of them have been used in Europe, and we are talking here about the vaccine produced by AstraZeneca, Pfizer, Moderna, Novavax, and Johnson & Johnson. We have managed up to this moment to have quite high vaccination coverage. As you can see in some countries, when we refer to the primary vaccination scan, only that the distribution of this vaccination coverage was not equal throughout Europe. There are countries that have reached vaccination coverage over 90%, especially in Portugal, Ireland, United Kingdom, and other countries. Just as per country that reach only 40 or 50%, it is about Romania and also Bulgaria, unfortunately. It is primarily about the country of Eastern Europe, where the phenomenon of hesitancy to vaccinate was very common. Additional efforts are needed because at the moment we have available the COVID-19 vaccine adapted from a bivalent formula that contain both the Wuhan variant, the original variant, and the Omicron variant BA4 and BA5 or BA1. We will likely ask a vaccination schedule in the future that will adapt to the evolution of this variant worldwide. It is likely that the vaccine against COVID-19 will be administered to adults for a longer period of the time as the same of influenza. So why it is need of the national program of adults? Because it is very important to discuss about not equality, just about the equity. Because it's very important to have from the different special group risk, from the different country, the national program to reach the same coverage, because it is one of the goal of the each policy makers. For example, in 2021 was proposed the European immunization agenda till 2030. By strengthening immunization system, implementation will help to reduce mortality and morbidity caused by the disease, preventable through vaccination, increase equitable access to new and existing vaccine for everyone, regardless of age, identity, of geographic location, strengthen of primary healthcare, and thirdly, contribute to achieve universal health coverage and sustainable development. Primary healthcare, it is here, and it is claimed to reach the equity in the field. We have some core principle. First of all, primary healthcare based is effective, efficient, and resilient immunization services are accessible to all people and integrated as part of primary healthcare programs. Equity-based, early intervention and strategy use an entity-based approach to reach and under-vaccinated population. It is very important to have access to data. Data are used to inform evidence-based decision-making, monitor progress, tailor local strategy to meet local needs, and foster transparency and accountability. And some other reason it is present here. But we have two different goals: disease control and equity and strengthening of primary healthcare system. It is important to address from the disease control because we want to control, eliminate, or eradicate specific vaccine preventable disease. When we discuss about the eradication, it is very important to reach some of 2 or 3 years in worldwide without the vaccine preventable disease. It is specific only from the chickenpox in that moment, from the smallpox, I'm sorry, in that moment. We have some vaccine preventable diseases like measles or mumps when the one European region and also the North America region, it is meet this condition from measles, for example. We have also some decision about reduce vaccine preventable disease outbreaks, because unfortunately we discussed before about the measles. Measles, it still happened at the outbreaks here in Europe. Romania, Italy, and also another country meet with this in the last years. When we discuss about the primary healthcare system, it is necessary to have equitable access, because the general practitioner is over all the field, and strengthening primary healthcare immunization delivery, because it is important to address this across the life course, including the adults. It is our topics in that evening. European Union decide to have in that moment effectual ensure access to vaccine for all, and control all vaccine to ensure highest safety standards, share clear, independent, transparent information, and more research to develop new vaccine, because we have new technology available in that moment. But unfortunately, distrust in vaccine is very high. As we can see here, country from like France, Italy, Romania, Greece, it is in that moment in the front with discussion about hesitancy of vaccination. So the patient come to us, come to our offices, and it is different point of view. For me, I can see the benefits of the vaccine preventable disease, but unfortunately the patient can see the adverse events, and that it is very important to lead from the decision about vaccination. We have in that moment some tools. For example, WHO Europe working from the application like Lena. It is available in Google, in the Apple Store, and also in other specific tools, when we can deal here with motivational interview regarding the vaccination. For me, it is very important because it is important tools to identify the vaccine hesitancy, to identify what is the best step to discuss with the patient regarding this process. About the vaccination passport. In that moment, more and more people travel the world. the epidemiological context may present certain challenges now or in the future. An example is the experience we had during the COVID-19 pandemic, when the COVID-19 certificate became mandatory in many European countries, both for its own citizens and for visitors. It has been seen by many states and by some citizens as a factor that limits mobility, but in a given context, it protects public and individual health. At the moment, it is no longer used in Europe, but many countries have developed electronic national vaccination register so that the vaccination history can be viewed. For example, we have a national register of vaccination, but also a software of our offices that can generate an interface from the patient. It can be accessed from mobile devices and presented as proof of vaccination history. Vaccination remains one of the most important public health measures that help limit the spread of some disease. So we conduct at the WMO, because I can, Ferdinando say before, I am the General Secretary of the WMO, a survey regarding the vaccination process across the Europe WMO country. We this survey started last month, according to preview discussion in General Assembly, and you use Google Forms. We have 25 members in that moment. We fill 23 response to country 2 response, United Kingdom, Switzerland. So we have 21 country. In this country, GP practices, it is involved in child vaccination, where the child vaccination, it is provided only in GP practice. 6 countries, United Kingdom, Ireland, Sweden, Portugal, Romania, and Turkey. GP practice, it is and other facility vaccination like pediatrics and other, it is in 10 countries. Now GP practice is involving in 5 countries: Finland, Norway, Serbia, Croatia, and Netherlands. Serbia only in pediatrics. When we discuss about the other facility, we discuss the vaccination center, where it is present also the family physician, in the pediatrician offices, in pharmacy, in community, in health centers, school, and special preventive services, where it is only the nurse. But when we discuss about the adults vaccination, as we can see, just one country, it is not involved in provide the vaccination, Finland. All the European country, it is involved in provide the vaccination only in GP practice, 5 countries, and other facility, 15 countries. Vaccination center, hospital, pharmacy, community health center, other specialty. Even in Finland, our colleague GP, it is involved in recommendation from the vaccination. It is very important task for our specialty to recommend the vaccination, to discuss with the patient about the benefit of the vaccination, and to have to contribute to reach the goal of the coverage. So WMO is the member of the coalition for the vaccination. In September 2021, we have a manifest, and we want to recommend to protect yourself from illness and possible severe or life-threatening complication. Regarding the COVID-19 vaccine, we want to bring from the patient the information about the safety and effectiveness of the vaccination. And it is very important to have capacity from healthcare to provide this vaccine. It is some strategy to improve the vaccine uptake and coverage. It is required to establish the value of adults vaccination in the eye of the public, payers, policymakers, and healthcare professionals. Improve access to recommended adult vaccination by improving the adult vaccine infrastructure and developing public-private partnership to facilitate effective immunization behavior and ensure fair and appropriate payment for adults' immunization. In the conclusion, there is a very large discrepancy in the approach to adult vaccination across the Europe. Only for the flu and COVID-19, there are vaccination programs from adults in all European countries. Addressing the phenomenon of the vaccine hesitancy is important as tailoring vaccination program. In this condition, it becomes very important to develop strategy regarding the vaccination passport, national vaccination register, and other tools to use from reach the coverage, the target coverage from each vaccine preventable disease. Thank you very much.
Okay, thank you very much, Dr. Dumitra, for your interesting presentation, very interesting presentation. The topic is really very important, and I think that Professor Winker wants to make a comment or a question for you.
Well, thank you for the nice presentation, and I enjoyed it very much. It gave us a glance on what is going on in Europe with the adults vaccination. But I just want to share with you my experience. You know, by chance today, half an hour before this lecture, I got my Omicron booster. I don't know if it was planned in advance, but I am now after this vaccination. And I think that family doctors have a very important role in encouraging their patients to go to vaccinate, also by personal role model. But you know, this long-term relationship between the family doctor and his patients have a huge contribution for preventive measures. I published, I think, around 10 years ago, a publication that make the link between the family doctor preventive measures and his patients. And I showed there that female family doctors that had their own mammography, their patients have more mammography. Family doctors that had flu shot every year, their patients have much more, significantly more been vaccinated every year. So the role model and the importance of family doctors should be exaggerated and pointed in every forum that you are talking all around Europe. You know, we are going to very high forums in the EU. Family doctors are very important in the introduction and the vaccine. Even if they are not vaccinating themselves in their own clinic, they're sending to the nurse or to other centers. The role is very important.
Thank you very much, Professor Winker, for your nice comment. And I was actually watching at the chat, but there are just thank you. You can also ask questions about the thank you. But I have some questions myself, and this derives from my actual practice, because nowadays, you know, my patients or all the patients are receiving the booster for the COVID, but at the same time, they are receiving the flu vaccination. And I also propose the vaccination against the herpes zoster and the vaccination for pneumococcal infection. And some of these patients say, oh, doctors, but our immunity system can resist to all this stress. What's your response, Gino, to these questions? How can we reassure our patients?
The immune system, it is available to provide the antibody from many antigens. It is very possible to have a lot of the vaccination simultaneously or different interval, depends of the type of the vaccine, because the capacity of the immune system, it is more higher. For example, we have meet with each year, in each hour, we have interaction between our immune system and also on our microbiota. Because the microbiota is very important from us and communicate permanently with our immune systems. So one vaccine, it is only a very short draw in the ocean with water. And it is more important to understand the vaccine, it is not something special. It is something common who will happen in each time, in each second, in each hour, in our systems, and we discuss effective with our microbiota.
Okay, now finally, there are some questions from the audience. The first question is, what about vaccine rejection in Europe? Can you give us the figures? And the second one is in a way related to how do you think vaccination will be in the next 20 years?
It is very difficult to answer from the second question, because as you can see in the last year, we have some new technology regarding the vaccination and also the vaccine. In that moment, I think the method of mRNA will be available from more and more vaccine in the future. We can discuss in that moment about the implication of the new technology regarding the cancer therapy and also to another application. I think the future, it is brilliant. And I think in the future, we will have also the new challenge, because for example, in the population of the bird, it is in that moment some 5,000 candidates to become the pandemics from the flu. So I think the knowledge in these fields, in special in the producer of the vaccine, will be the most important challenge in the next years. Regarding the last pandemics, in only 1 year, it was possible to produce one vaccine against that disease. It is, I think, one of the most important example, and what will be happening in the future, it is very interesting. Regarding the vaccine hesitancy phenomenon in Europe is different. As you can see in my presentation, we have some champions here. Romania is there, France is there, Italy is there, and also the country where the authority decide to introduce mandatory vaccination was because they have a high level of the refusal of the vaccination, unfortunately, and I think. We discuss in that moment three types of the behavior of the population. First of all, some population, some where 20% accept any vaccine without the discussion. But unfortunately, a small number, 10% or 2%, depends of each country, refuse each vaccine. In the middle, we have a very interesting area where we discuss about the vaccine hesitancy. Vaccine hesitancy, some people say, I want to be vaccinated, but I'm afraid. And other populations say, I don't want to be vaccinated, but I want to discuss with you. So in this situation, here, it is our ability to discuss with them, to convince them to be vaccinated, and to make them to take the decision, because the population, the people want to be the proper decision about the vaccine and about the vaccination. I think this is our role, our discussion, our GP involving in this process, because in the future, vaccine hesitancy will be one of the most threat of the public health.
Okay, I think that we have time for other 2 or 3 questions. The first one is very practical. When is the best time to vaccinate? Before, during, or after the pandemics?
Depends. Depends from which vaccine preventable disease discussion. If we will discuss about the pandemics, the COVID-19, it is impossible to be vaccinated before, because we don't know what is the agent. In the pandemics, it is very important to reach the vaccine when we will be disposable, because we have 1 year from the research when we have the vaccine. In that moment, is the proper decision. It is the proper time to provide the vaccine from each population, because in that way we can stop the pandemics. And of course, after the pandemics and the outbreaks, it is important to maintain this status because, as you can see from SARS-CoV-2, for example, it is possible to choose new variant, to have evolve new variant, and we will be addressing with specific vaccine from this.
Oh, this is a very interesting question from Georgia.
Sorry,
From,
I want,
yes.
Ferdinando, I want to continue. If we discuss about the epidemic outbreaks, for example, from the flu, it is important to vaccinate it before because we, in that situation, we have the vaccine.
Okay, as I was saying that there is this request, it seems more than a question, a request from help from our colleague Anna Carelli from Georgia. And her question is, what do you recommend are the steps could be taken regarding patient education for the need of vaccination? In their country, there is a huge amount of the population who is against the vaccine during the pandemic. So what is your suggestion?
It's the same situation in the other country, Eastern European, unfortunately. It is in Romania, it is for example, in Romania, we have 50% of the population unvaccinated against COVID-19. Even we can see in the western part of the Europe where the country who reach 90% from primary vaccination, primary schedule. In Romania, we decide to address him with a motivational interview. Motivational interview help the patient to make the decision. So first step was to introduce these tools in our activity. In the last year, we have 2 programs when we prepare 80 trainers. We have 8 trainers with which 10 trainers from this. And now we the 80 trainers prepare 400 healthcare workers in the vaccination field. We want to bring in this field the motivational interview because it is the unique solution to discuss with the patient, unique effective solution. It is impossible to make this vaccination mandatory, unfortunately, in this country.
Okay. I think that we can now, there is time for the real last question. Maybe it's for you, but also for Professor Binker. And it is the role of artificial intelligence and machine learning in the next 20 years. Can they also have an impact on vaccination? What is your opinion? This question is by our friend José Miguel Bueno from Spain. Is there a space?
I would, usually when you don't have a good answer, you ask another question. So, so my question is, I don't know what would be the contribution, but we see that, and as Gino said, the technology is more advanced and we can rapidly adapt to new, even for new viruses and for new strains, etc. But another topic that is worried me is the cost of the new vaccinations. During COVID pandemic, every country, every ministry was willing to pay as much as needed to get the vaccines. But the new you talked about the new flu vaccine, the tetra. The new strength vaccine for flu, which is quite expensive. Shingles vaccination is expensive. And I know that at least in my country, many good vaccines are not entering to the pediatric population because of the costs. So are there any plans in the level of the EU to try to reduce the cost of the new vaccinations?
Okay, thank you very much.
So,
a final comment.
So Gino,
artificial intelligence was used in the last vaccine preventable disease, COVID-19. The coding, the genetic code of the SARS-CoV-2 was using with artificial intelligence, because in the specific condition, the world condition, it become impossible to have one vaccine in 1 year. If I remember well, the first information about the SARS-CoV-2 was in 31 December 2019. In 11 January was published the genetic code of the SARS-CoV-2. That means artificial intelligence.
And what about the costs?
It doesn't matter because
The cost of the vaccine,
Chris.
I mean.
Okay, I don't know. It is impossible to respond about this.
Okay, there is the real last question, because sorry, but I didn't see this question, and it's about at what age the pneumonia vaccine should be stopped. I don't think that there is a way, an age to stop. It's every 5 years, but not to stop.
No. The vaccine, pneumococcal conjugate vaccine, become with one very important benefit. In the past, you use the polysaccharide vaccine, 23 valents. From this vaccine, it is necessary a booster at each 5 years. But pneumococcal vaccine, conjugate vaccine, come with the protect effect of the long term. So in that moment, we have a high recommendation from each people over the 60 and also with specific condition to reach one pneumococcal conjugate vaccine. After that, a 6 month, minimum 6 months, depend on the condition, a polysaccharide vaccine. And in that condition, it is not need other booster.
Okay. Okay, thank you very much. I think that this now it is time to end this webinar. And thank you very much, Dr. Dumitra. Thank you very much, Professor Winker. And I hope that you've all enjoyed this webinar as much as I have. Good night, and thank you again.
Good night.
Thank you, Ferdinando, and good night.
Bye.
And thank you,
Good night.
and thank you, Gino, as well. And good night.
Thank you very much, Tomo.
Bye.
Thank you, Ferdinando. Bye-bye.
Thank you.